Hello and thank you for joining us. This is Health Matters on Channels Television. I am Mary Alale Yusuf. The global count of confirmed COVID-19 cases is now over 223 million. And as at Friday, September the 10th, the death toll was over 4.6 million. In Nigeria, there were more than 198,000 confirmed cases of COVID-19, more than 185,000 recoveries, and 2,588 deaths. There were over 4,000 new infections during the week between the 3rd and 10th of September. Speaking about the Delta variant, escalating things. Thankfully, more than 6,000 recoveries were recorded. 93 people died within that week. Recovery rate is up to 93.7%. Case fatality is 1.3%. Tested samples are over 2.8 million. Epidemiologists are public health workers who investigate patterns and causes of disease and injury. They seek to reduce the risk and occurrence of negative health outcomes through research, community education, and health policy. A primary goal of field epidemiology is to guide as quickly as possible the processes of selecting and implementing interventions to lessen or prevent illness or death when urgent public health problems arise. My guest is the resident advisor, Nigeria Field Epidemiology Training Program, and member of the Africa Field Epidemiology Network. He joins us from Abuja. You're welcome to the show, Dr. Shakir Balogun.
Good afternoon. Thank you for having me in your studio today.
Okay, so let's start off with, let me ask you, is it just urgency alone that is the difference between field epidemiology and the regular type?
Yeah, so for us, the version of epidemiology that we practice is also known as applied epidemiology. So it's not academic epidemiology. We're not just interested in knowing how frequent diseases occur, what are the risk factors, what are the protective factors. We want to be able to apply the knowledge. And that's why field epidemiology is otherwise known as interventional epidemiology. So we want to know so we can act. We want to know so we can prevent the occurrence of diseases. We want to know so we can control disease outbreaks and also attend to other public health emergencies and priorities. So the main difference is the fact that we are focused on application.
Okay, so how has this brand of epidemiology impacted on the COVID-19 pandemic?
Yes, so the COVID-19 pandemic, in fact, right from the time when most countries in Africa were preparing for their first case, Nigeria started to prepare as well. So we set up a technical working group that put together a preparedness plan. And at that stage, that was led by graduates of our training program, a field epidemiologist. And when we had our first case, field epidemiologists were deployed all over the country, screening at the points of entry, that's the airports, conducting surveillance, investigating cases, conducting contact tracing, analyzing data, all over the country, at the national level, at the state level, at the local government level. So field epidemiologists play a role, in addressing public health emergencies such as outbreaks. It has happened in the past. If you can remember, in 2014, when we had Ebola outbreak, field epidemiologists were there. Field epidemiologists from the Nigerian Field Epidemiology Training Program, WHO, and other organizations were there to do the contact tracing in Lagos, identify all cases, isolate them, and trace their contacts so that we're able to interrupt the transmission of the disease in record African time. So that's the kind of thing that epidemiologists do during emergencies. And of course, in between emergencies, we conduct surveillance. We're on the constant lookout for diseases. Where is cholera occurring? Are we having excessive cases of Lassa fever? Are we going to have an outbreak soon? So we have these constant surveillance, constant monitoring of the frequency of diseases, where are they occurring, and the rest of that, so that we can nip it in the bud. We don't have to wait till we have a large outbreak before we act. We want to know so that we can act quickly and prevent excess deaths.
When COVID-19 came on the scene, there were a lot of conflicting ideas, for example, about masks. Should we wear them? Should we not wear them? Then there was the problem of how far is far enough for physical distance? When should we have a lockdown? Some people went as far as to say that these scientists are confused. Now, is this typical of new diseases, new outbreaks?
That is true. So for us in epidemiology, epidemiology is a data-driven science. We're always looking out for the best evidence to act. And evidence changes, particularly when you have a new disease. When COVID-19 came on the scene, it was several months and years ahead of us. It was a brand new virus. We didn't know how it was spreading. We didn't have a vaccine for it. So we had to act at the beginning based on what evidence was available. And scientists all over the world continue to collect data, analyze data, conduct epidemiologic studies, vaccine trials. And so as those things were happening, the evidence was building up, it was changing. So the policies to be implemented were also changing because the policies are based on the evidence, the best evidence available. So evidence kept changing. And today, beyond the original variant that afflicted the world most of last year, we have a lot of new variants of concern. And the epidemiologic behavior is different. They are a lot more transmissible. So things keep changing. The evidence builds up and changes. Therefore, the policies also have to change. The interventions have to change as well. So it's not confusion. It is acting on the best evidence available.
That's a very fluid profession to be in. Are we likely to see any changes then in the future, since it appears that variants are still emerging? Are we likely to treat this disease a bit differently, see it a bit differently, maybe respond a bit differently in the future? And are we ready for that?
Yes, so I'm beyond, well, I would like to say first that beyond the epidemiologic evidence that we were talking about, when we want to implement interventions, we also have to think of other things. So it's not, strictly speaking, a scientific endeavor. There are so many other things that you have to put into consideration. Outbreaks have economic implications, they have social implications. So you have to factor in these other things, the cultural implications, the social implications, the scientific, the economic implications before you make the final decision. So we advise government. We are not ultimately responsible for what government does, but we provide the best scientific evidence, but we're not the only people. The economists also talk about the impacts on the economy, and other people, the people in the educational sector, talk about what will happen to education. So it's a fine balance that the government has to maintain at the end of the day. So the government is responsible for everybody. The government has to weigh all these evidences before a final decision is taken. And this virus continues to mutate, it continues to change. So we don't know what's going to happen next. And that's why we keep watching, we keep monitoring all these different variants that are coming up.
You talk about economic implications, maybe social implications. I'm interested in what is this cultural content that you have to consider, to give advice about the epidemic, to give advice about how to behave or what intervention to take, something cultural, peculiar to Nigeria.
Yeah. So the thing about epidemiology and public health interventions is that they are not conducted in a vacuum. They are conducted within a cultural environment. They are conducted within an economic setting. So you have to bear all these things in mind. You need to know about, the fears, the desires, the aspirations of the people you are going to implement the interventions on. You need to know what they're thinking. You need to engage them. And that's what we do a lot of the time. So what are you people thinking about? What are the issues? So engage them. It's a dialogue. Let them realize the risks. Let them appreciate the risks of, of not adhering to the policies provided by the government, and also not adhering to the different interventions that have been laid down. So it's very important to engage the community. We don't just design interventions in our offices and go out there and implement. No, we have to do community engagement. We need to know what the people think. If you can remember, if you've been following events, years past, we had issues around polio. Those days when people rejected polio vaccine, it took a lot of community engagement. for people to realize the importance, the utility, the usefulness of taking this vaccine. And at the end of the day, we succeeded. Last year, we were able to actually interrupt the transmission of the wild polio virus. It's not an easy thing. You have a lot of people circulating conspiracy theories for their own reasons, people circulating misinformation. We have to be able to counter these so that our epidemiology and other public health interventions can work. So it's very important to know the culture of the people. It's part of what we train our epidemiologists on, cultural competence, cultural intelligence. They need to be able to understand the culture of the people they are relating to, the people they are trying to help.
Speaking of interruption in the progress of a disease, we've had cholera for a while now. Cholera is not a new disease. It's something that recurs, and we have it now in more than 20 states. What is the challenge for cholera?
Yes, it's so unfortunate that we've known that it's polluted water that causes, cholera. We've known this for a very long time. In fact, in the mid-19th century, in the 1850s in London, people used to die a lot of cholera. People used to die of cholera in Europe and many parts of the world. But around that time, a doctor called John Snow was able to demonstrate that cholera was caused by water that was polluted with sewage. And that is the cause of cholera. It has not changed. And that's what causes cholera every year. That's why we have cholera during the rainy season. A lot of our people defecate in the open, they defecate in the streets, they defecate where they're not supposed to defecate. And once the rains come, the rains wash, the feces into the streams and the wells, and people take these and start having cholera. So it's a very, very easy thing to prevent cholera. It is absolutely preventable. All you need to do is make sure that drinking water is not contaminated with feces, and that's it. So it's an engineering issue. It's not even strictly speaking a Ministry of Health issue. It's an engineering issue. Once we have safe drinking water, we will not have cholera again. So it's a shame. It's a huge disgrace that we continue to have cholera every year, despite having known for about a century and a half, that cholera is caused by water polluted with sewage. The science is so straightforward, it's so easy, but it takes, we need the political will of the government to be able to achieve this. So the government needs to do a lot in providing people with safe drinking water, pipe-borne water, water that has been treated and is safe from contaminants, bacterial contaminants, and the rest of that. So cholera keeps occurring every year because the government has failed to provide people with safe drinking water. A lot of people have, boreholes in their homes and they feel safe, but the vast majority of the people can't afford that, and they are vulnerable to cholera, and they continue having this cholera year in, year out. This year already, more than 2,000 people have died from about 60,000 cases that have been reported. It's a huge shame. We should not be having cholera in this age and time.
Let me quickly talk about smallpox. We had the smallpox vaccine, eradicated smallpox, and it was found out that that vaccine was also preventing monkeypox. But now monkeypox seems to be coming back again. What would your advice be for, getting rid of monkeypox?
Yeah, sure. So the vaccine for smallpox, was administered all over the world, and we were able to interrupt the transmission of smallpox. And so a huge proportion of the people in the world had antibodies to protect them against smallpox, which was also protecting against monkeypox. But since we have eradicated smallpox, we've not been vaccinating people. So a huge proportion of the people now are vulnerable. They are not immune to having monkeypox. So monkeypox has been cropping up. So what we are doing is we are collaborating the human health and the animal health component. Monkeypox is one of those diseases known as zoonotic diseases. These are diseases that circulate in animal populations and can spill over into human populations. So we're doing a lot of work to identify the animal source, the reservoir of this monkeypox, so that they can be dealt with. So there are different ways of eliminating a disease. You can have a vaccine, or you can also attack the reservoir. So we are working on that, but I don't think there is currently a vaccination intervention for smallpox yet. So a lot of work is still going on. Evidence is being gathered as to the best way. But for now, we have put it on the list of the diseases that we are conducting surveillance for. We are watching out for it. Where is it occurring? What are the patterns and the rest of that? So we're preparing for the next outbreak, and we're trying to stop, subsequent spillovers by identifying the animal reservoir for this virus.
Okay, thank you so much. We will go on a very short break and come back in a few seconds. Please stay with us. Welcome back. This is Health Matters, and we're talking about epidemiology with Dr. Shakir Balogun. If you have questions on the topic, the number to call is 0808 054 2233. That's 0808 054 2233. And we are talking about epidemiology. Dr. Shakir Balogun, now, mask wearing in some quarters is commonplace. We know Nigerians don't like to wear masks, but some people do wear masks as a habit, Before COVID-19 came on the scene, how did epidemiology change some of our behavioral patterns and some of our science for good, pre-COVID?
Pre-COVID, well, I think epidemiology has been in fact, epidemiology is the basic science of public health. Every intervention that you see in public health, things like vaccination, conducting surveillance for diseases, adding iodine to salt to take care of some medical conditions, all these things are based on epidemiology. Epidemiology has changed the health of our society because through epidemiology, we've been able to identify risk factors for diseases. It's through epidemiology that we know that excessive weight, is a risk factor for hypertension. Diabetes itself is the risk factor for hypertension. Inactivity, just sitting down all day without exercising, is a risk factor for hypertension. So it's through epidemiology that we got to know all these things. It's through epidemiology that we're able to know the relationship between poverty and health. So epidemiology, takes along so many other sciences like statistics, and geographical information system to provide evidence for public health. So most of the things you're looking at, most of the things that are being done in disease prevention and control are actually founded on sound epidemiologic principles. So epidemiology has changed public health. It has changed medicine, particularly in the last 50 years. And it continues to do so as we as epidemiologists and even non-epidemiologists. Epidemiology is actually a way of thinking. So beyond the professional epidemiologist, every other person in the health field also applies epidemiology one way or another. So we apply this thinking in order to identify the risk for diseases and know the things that can reduce the frequency of diseases and apply those in our ways of life. So in many parts of the world, lifestyle has changed. It was through epidemiology that we actually knew that there was an association between smoking and lung cancer.
Let me cut in there.
Countries, the rate of smoking has reduced.
Quickly and get the question of Ifoma, who is calling from Jeba in Kwara State. Hello, Ifoma, are you there?
Yes, I'm there. Yeah, good afternoon.
Good afternoon. What's your question? And if your TV is on, you need to put it off.
Okay, please, my question is that regarding to what the doctor said about pollution of water, I want to ask if drinking borehole is safe.
Okay.
Yeah,
so she wants to know if borehole water is safe.
Some people said it's not okay.
I'll let the doctor tackle that.
Okay, thank you.
Ifoma
is asking about borehole water. Can she drink it?
Generally speaking, borehole water is safer than surface water. The surface water, that's the water in the streams and the rivers, they're open to contamination. But borehole water is usually covered. It is deep down in the soil. Most of the time, it is safe from contaminants. And we usually advise people to make sure that the borehole is not dug close to a latrine or a toilet or a soakaway, so that we reduce the risk of contamination. But generally speaking, borehole water is safe because it's very deep down inside the crust of the earth. It's not like the surface water that is easily polluted with urine, feces, and other things. And if you're not safe, if you're not sure of the safety of the water you're drinking, make sure you boil the water, particularly water from streams and rivers and shallow wells or wells that are not covered. Make sure the water is boiled, or you can also disinfect using chlorine. There is a common brand called WaterGuard that people use. You can use that to make the water safe. Particularly during cholera outbreaks, we advise people to make sure that they do these things. And beyond that, people also need to continue to wash their hands after they use their toilet, wash their hands before they start preparing food so as to reduce the risk of cholera. So it's not just about the water, but also our hygiene habits. Washing of hands is very, very important, not just for cholera, but for COVID, for typhoid, and many other bacterial diseases.
Let's take this call from Mohammed, who's calling from Katsina State. Hello, Mohammed. We've lost Mohammed. But let me quickly ask you, can you tell us the importance or position of autopsies when it comes to epidemiological findings?
Yes, autopsies are very, very important. Sometimes before you even know what is happening, people have died. Sometimes the first case that brings the attention of an outbreak to the public health community is the death of a person. So we need to take samples, and there are rules around biosafety. The people taking the samples have to protect themselves and also protect the environment. So they find a very safe way of taking a portion of a tissue sample from the dead person to be tested in the lab. Once you take a tissue sample, you can do a whole range of tests. You can do tests, for known diseases, and you can also identify unknown diseases. In the case of COVID, COVID was brand new when it came on the scene, but from the samples that were taken, people were able to sequence the virus, and they were able to identify a brand new virus. So if you take a sample, from different parts of the body, based on the history, take sample, blood sample, and take tissue sample from the lungs, from different parts of the body, trying to find out the cause of a disease or identify the pathogen that is responsible. So autopsies are very important, but autopsies are performed by specially trained people. They're called pathologists or morbid anatomists. They're specially trained people that use special instruments and safety procedures to take these samples. So autopsies are very, very important. They create new knowledge needed for the prevention and control of diseases.
Okay, let me quickly ask you this. It seems that some of the biggest obstacles to containing a disease are the asymptomatic cases. Do you agree? And what can be done about those?
I perfectly agree with you. You're already an epidemiologist. You know the value of asymptomatic. So that's why it's a lot easier to control a disease like Ebola than to control COVID-19. Because for Ebola, it's very difficult to have the virus and not show symptoms. And once you show symptoms, it's very easy to deal with. Once somebody is symptomatic, we can isolate them, we can test to confirm and then isolate them. But people who are not symptomatic, how do you even begin to look for them? So they don't even come to the hospital, particularly for a disease like COVID, where the vast majority of people that get infected don't have symptoms. So it's very difficult. So it's one of the reasons why it's so difficult to control COVID. In fact, the perfect disease to control is a disease that manifests in everybody that has it. The moment somebody shows symptoms, you can quickly isolate them, take them away from the rest of the people, take care of them until they survive or the unfortunate event of death occurs. That was the way, we stopped the transmission of Ebola in 2014. But for COVID, it's a lot more difficult because the vast majority of the people infected don't show it. So you can't identify them, you can't isolate them.
I must say, well done to you. It's not an easy job. Thank you. I noticed you also dabbled into some non-communicable diseases there. Thank you very much. It's been wonderful having you on the show. We've come to the end of it, and I hope you'll come again. Thank you so much, everybody.
Thank you for having me.
Of course. Thank you at home for watching and being part of this show. Thank you to Ifoma, who called, and Mohammed. Have a wonderful day. I am Mary Alale Yusuf.